Hi, I'm Debbie Georgatos. Welcome to my show, America, Can We Talk? Today, we're going to talk about Trump-Deranged GOP'ers, great COVID news from University of Pennsylvania, the Lancet magazine's Hydroxy walkback and Dr. Fauci's silence, and Dr. Robin Armstrong joins us for Hydroxy update. And of course, I'll tell you why these stories matter to you. Stay tuned.
Debbie Georgatos, host of America Can We Talk, is an author, attorney, and political analyst whose mission is to inspire the American political conversation about preserving liberty in the best country on earth.
Hello again and welcome to America Can We Talk and to today's First Five. You know, I want to talk today, this First Five, about this amazing phenomenon going on with people who have alleged GOP connections. They are Republicans, GOP people who are coming out against Donald Trump. And I actually want to preface it by saying there was an interesting article out recently by a doctor. He is his name is Robert Whitley, and he specializes in social psychiatry. And he was talking basically about Trump derangement syndrome. And to be specific, he's talking about the idea that, you know, when President Trump won, many people who thought he would never win, didn't like him, were obviously, as we all know, very upset. But he's actually talking about the psychological process in your brain, the physical process in your brain when you are so unhappy about something, what's actually happening to these people. He talked about dopamine, which is within humans, the chemical that is emitted as a reward or pleasure transmitter. So that's, you know, makes you're kind of happy. That's a good thing. And then cortisol, which is released in response to fear. And he's talking about the fact that both of those, dopamine and cortisol, actually interfere with your prefrontal cortex. They create prefrontal cortex dysfunction. Short story, he's kind of saying Trump derangement syndrome, even though it doesn't have a psychiatric definition, you couldn't find it in a college class learning about psychiatry, but it actually is a physical thing that the reaction of the brain when you're so unhappy about something, you're just driven crazy, you can't reason. You aren't functioning. You can't process information. You can't. I mean, you really are in some way deranged when you have this. So he's talking about this Trump derangement syndrome. He's basically saying it is just just makes people truly unable to think, unable to reason. And so I give you Colin Powell. And I'll tell you, before I tell you, I'm going to go through Colin Powell, George Will, and a few others. But part of what is so bothersome about the alleged GOP figures, people on the conservative side, America lovers, always will say, well, you know, they're really in politics because of ideas. They stand for ideas. They stand up for this idea, that idea. They claim that's why they do politics, because they believe in free markets, limited government, you know, the people on the conservative side. But they're so bothered by Donald Trump, by his, I suppose it's probably personality. It's very, you know, he's very direct. He's very, some people might say brusque. I think he's just direct and down home. He says what he thinks. He doesn't, you know, engage always in a statesman-like conversation, but he engages with the American people in an American conversation. But his attitude, his demeanor, the way he speaks, drive these people so nuts they can't even think. And in particular, Trump's victory in 2016, his victory in the race for president was consequential in ways that people will be studying for decades and probably centuries, and it was essential in the preservation of America. Nothing less than it was essential to the preservation of America. Donald Trump won the presidency at a time the radical left had us almost over the cliff to socialism, that already started us down the path of this hideous socialized medicine. You had a President Obama, 8 years in office, spending time demeaning the idea of America, mocking the idea of American America being exceptional, mocking the importance for borders, for sovereignty in America, more and more deferential to international organizations, more willing to defer to the UN and their climate treaty and whatever the Iranians wanted. They want weapons, let them have weapons. You had a president in for 8 years who was demeaning the idea of America, diminishing it, and you had the radical left in this country, of which Obama was then the leader, very much steering this country into a more government-controlled society, radical increase in the amount of power in Washington, collect power held in Washington through regulation, the expansion of the bureaucracies, more and more power held over individual businesses and agencies. It was a massive government increase time under President Obama, and not just increase in numbers of regulations or amount of taxes, but in the whole concept, the political idea of America was transformed for 8 years under President Obama from being a country rooted in the rights of the individuals to live in liberty, and transitioning under Obama to a country rooted in government control over society, where the government will tell you how much freedom you can have. They'll just let you know. It is a truly horrific and bad transitional time under President Obama. It was the abandonment of many of the core concepts of America, and transitioning America toward the expectation of being cared for by the government and being controlled by the government, and making that the norm. The normalization of socialist and Marxist ideas rapidly expanded under President Obama. So Trump comes along in 2016, and all of that met up against the boulder, the roadblock of the Trump victory. So the Trump victory was not just happened to beat Hillary, it was putting a boulder in the road, a barrier that says we're not going to be a socialist country. We're going to go back to the America of our founding, the America of freedom. We're going to have secure borders. We're going to have actual borders. We're going to have sovereignty. We're taking back our sovereignty from international organizations. It was a huge shift in American thinking when Trump won. This is really more than his personality is. This is the reason the left despises Trump so much, because Trump stopped the leftist transition of America from a country rooted in freedom, and the way they were trying to make it, the left trying to make it a country controlled by the government, will tell you how much freedom you can have, to a country. And so Trump's victory came along and stopped that. This is why the left hates him. They may or may not like his personality, but what drives them nuts is that he is truly draining the swamp. He is getting rid of the entrenched ruling elite class in Washington as much as he can. This is why the left really hates Trump. So back to the GOP'ers coming out against Trump, this is why they're getting just getting all wound up, wrapped around the axle about Trump's personality or his demeanor, or he isn't polite enough, or he doesn't speak the way I'd want him to do, or he tweets too much, or whatever it is they don't like about him. This is the most shallow, petty, impossibly unacceptable behavior by so many people on the right in this country. They're bothered by, I don't like his personality, I don't like his tweets, I don't like whatever it is they don't like about him, and they cannot give credit for it. They cannot recognize he saved America from what the left was going to do to this country. That's what Trump did, and that is why it is so inexcusable for people like Colin Powell, as an example, to come out in favor of Joe Biden. Just think about what Colin Powell is telling you about himself. Okay, he was barely a Republican when he was in office, or was more active in politics. Barely a Republican, just like this much Republican. But this is a guy who can watch what Trump has done, steered us back on track to being a country rooted in freedom, away from what the left was trying to do. And Colin Powell's too prissy to not like Trump and say, I don't like it, I'm going with Biden. Biden, who doesn't even know what year it is, what office he's running for, is confused. And when you do dive into Biden's history, he's a leftist just as much as Barack Obama was a leftist. He just has a face that looks kind of all-American to more Democrat voters. So you have Colin Powell coming out saying, I just can't support this guy. You have George Will, who's truly lost his mind. He actually left the Republican Party in 2016. But he's actually come out now. George Will, formerly a respectable commentator. I've actually heard him speak at some event we went to. He's pretty entertaining, very bright. He's come out with something. He's actually urging Republicans to, as he says, vote against Trump and vote out every Republican in Washington who is supporting Trump. This is George Will, the former Republican, saying it's so important to have Trump gone that no matter what it takes, even including allowing the Democrats to have a majority in Washington. That's okay with George Will, long as we get rid of this guy Trump. And why I'm so worked up about it, why you should be so angry at these people, is because they're judging, they are bent out of shape over Trump's personality, his tweets. He tweets about things he shouldn't be talking about. Why is he weighing in about Drew Brees and the NFL? Why does he have to do that? Even if you want to agree that maybe Trump's tweets, some of them you don't like, some of them you do like, some of them, whatever different policies he has. You had America almost over the cliff under the Marxists under Obama in 2016, and you had America literally rescued from the ugliness of leftism, turned back on course, and Americans like George Will and Colin Powell need to get over it, get over their prissy complaints about his personality, and understand Trump saved this country. That's what happened in the elections of 2016, and that, my friends, is today's First Five. Okay, so the next thing I'll tell you very quickly, we had some great news on this COVID-19 situation, but I will tell you, I think Matt the Wonderful is telling me that we have, okay, good, okay. So we have Robin Armstrong. I'm going to switch orders here. Robin Armstrong is a great doctor. He's a doctor here in the state of Texas, in Houston area. He was on a few weeks ago, and he was talking about the use of hydroxychloroquine in his practice, and he and his team, their practice, worked with a retirement community facility where they did have an outbreak of COVID-19. He talked about the use of hydroxychloroquine. So since we have him on the phone, let's just jump to that story now. We'll talk to Robin Armstrong, and then we'll come back to the rest of our story. And there he is. Hello, Dr. Armstrong.
Hello there. How are you?
I'm glad to see you is how I am. Thank you for joining me today. I know you had a busy day. Thank you.
Yes.
Okay. Okay. Well, let me start with, I think last time you were on, you were talking about you were using hydroxychloroquine in this retirement facility. And I just want to get a wrap up on that story with your patients there. You continue to stand by the notion that hydroxychloroquine, and I think maybe along with other prescriptions, you found to be not only effective, but actually the most effective that you were aware of in dealing with COVID-19. Is that right?
Absolutely. And that is still the case. I believe that in certain circumstances, certainly if you use hydroxychloroquine, you can also add azithromycin and zinc to it. I think if you use those early on, then you actually will prevent the patient from going to the hospital, prevent the patient from going on the ventilator. But I believe the key is using it earlier as opposed to later. None of the studies that have been done have used it earlier. They've all used it in critically ill hospitalized patients. And what has happened in our case is we treated 38 patients with it, 38 of the sickest patients, elderly patients, infirm patients, all with cardiac disease. We treated them with it, and 37 of them recovered from COVID-19. We had two others that died of other causes later. One was an elderly lady who was 102 years old, but we had a great outcome in this, and the media has been amazing. They've been very political, and they've attacked this, which amazes me. And it's just their hatred for the president. It knows no bounds, and it knows no shame either. It's just shameful that they have attacked this president in this way, just because he spoke out positively against it. We've had physicians and medical personnel actually come out against it simply because the president was in favor of using hydroxychloroquine. Well, the science now shows it. I actually wrote that in a USA Today piece recently, that the science actually supports the president. And as we go on, this big Lancet study has been debunked and pulled by the authors. And so that's showing that hydroxychloroquine is probably successful and likely safe.
Okay, well, I was going to get into that Lancet study. I'm so glad that you brought it up. So Lancet magazine is, in America, we have the New England Journal of Medicine. There may be other ones, but a premier in America, New England Journal of Medicine, and in England is the Lancet. It's been around for a long time. Lancet is like over 100 years old, well over 100 years old. But this was the most amazing thing. Lancet ran a study originally claiming that not only hydroxychloroquine was not effective in helping patients with COVID-19, but it had dangerous side effects. And they've had to, first they walked it back saying, well, we're putting a caution note out. And now they have completely walked back and withdrawn their support for that study. So I don't know if you followed the detail of it, but what is are you familiar with why it was the study was now found to be so unacceptable? It had to be essentially retracted?
You know, well, what happened was, I believe I said Lantus earlier. That's a medication that I use commonly, but Lancet, you're right, is the name of the magazine. The Lancet study was pulled back because they use a company in the United States that is a pretty shady company. They have a history of not collecting accurate data, and so all of the authors of the study used this one company's data, and when the authors actually produced the study, which shows that there is a political bias, because they should have asked to look at the data first. So they actually just received this data from this company that collected it all, and they just went ahead, analyzed that data without looking at the source of it, looking where it came from. And so this was all faulty data. This was not good information that they were gathering from all these hospitals. And so the authors themselves, and I thankfully they're fairly honest people. The authors pulled the study, retracted the study, and said that this doesn't prove what we said it did. And so what we found is that this study, the malpractice in this is enormous, Debbie. What this study did was the World Health Organization immediately stopped studying hydroxychloroquine. They pulled it out of the clinical trials, saying it was not safe. The entire country of France, where hydroxychloroquine has been used as a first-line agent, completely shut down the use of hydroxychloroquine as a therapy for COVID-19. The FDA changed its mind and further restricted the use of hydroxychloroquine. So you had the entire world basically using this one Lancet study and they reversed their policy. I believe that this study has cost lives. I believe that there is clearly a political agenda that is working in this. Lancet has been a fairly left-leaning magazine publication, a scientific journal for some time, and now it's just proven. And it's really unfortunate that this is happening, because it's affecting lives all over the world. And so certainly since that happened, the FDA still hasn't reversed course, but France has reversed course. The World Health Organization has re-entered hydroxychloroquine into the study, into the clinical trials. And so I think it's really unfortunate when politics enters into science like this. It is dangerous for people, especially in the setting of a pandemic where lives are at stake. And we just can't allow this to happen again. This is shameful what's happening. The left and the media are publicizing every negative study, irrespective of how accurate it is, irrespective of where it comes from. And they seem to just have this great distrust and hatred for this president that it's even costing lives as a result. They are willing to cost American lives and lives all around the world because of their hatred for Donald Trump. And that's really shameful.
It's just honestly so amazing, too. I was going to ask you, in the course of your practice of medicine, I know you practiced medicine, I think it was almost 20 years in Houston. Have you ever known of any other disease therapy where the medical studies, the medical practice, the assessment of the efficacy of any treatment got so wrapped up in and actually kind of hijacked by politics? Have you seen that before?
I've never seen this before. Now, HIV, we saw it to a limited degree, but it was never, everyone was on the same page about how, we were going to try it and attack the HIV, AIDS epidemic at the time. So it certainly had politics entered into it, but never to any degree like we're seeing with this pandemic right now. This is really, really shameful what's happening. It's costing lives. In fact, I've just submitted an op-ed to the Wall Street Journal talking about how we have to put science cannot be debated on the airwaves. Science cannot be debated by politicians. It cannot be debated, in the way that we have, because by the media and by leftists. It just can't be debated that way. We have to be able to be very to be very concrete. We have to be very black and white. If it works, it works. If it doesn't, it doesn't. And we have to be able to produce good science to get therapies for people. And in the setting of a pandemic where things are changing so quickly, it is essential that we get good information out. And everyone talks about data and accurate data. Well, the American people and the people of the world have to be able to trust the data. We have to be able to trust that the scientists are doing the best thing and do not have a political agenda. I saw a group of scientists the other day actually signed a piece of paper. They had scores of scientists that signed this that said that because the protests were so important, and because racial, these racial issues in this country are so important that it was okay if they were protested in spite of being in a pandemic. It's okay if they don't social distance. So we still have to social distance in churches, at athletic events, at schools. But it's okay if the folks who are protesting do not social distance because the racial injustice issues are so great. Now, people have a right to protest, certainly, but for scientists to sign a document saying that somehow because your cause is so great and the morality of your cause is so strong that you should be able to do this, that the virus somehow is going to distinguish between a protester and
Yeah.
someone who's at an athletic event. That's amazing to me. It's putting lives at risk. So these scientists are putting lives at risk. And everyone expects that 2-3 weeks from now, we're going to see an uptick in the number of cases, potentially in the number of folks going to hospitals because of these protests that have taken place. And so we have to really be, we have to be adults about this and really get the political agenda out of science and make sure we're just producing results for the health of the public.
Absolutely. I could not agree more, Dr. Armstrong. I was going to ask you also, there was I think this article was from May 27th. So I'm glad you mentioned that the impact of this false article, or false report of inaccurate findings that made it to Lancet and to New England Journal of Medicine, it impacted WHO, the World Health Organization. You mentioned France, but even in America, Dr. Fauci, who is the primary advisor to the president related to our handling of the coronavirus crisis, on May 27th, his statement was, "Science shows hydroxychloroquine is not effective as a coronavirus treatment." That was his statement. Do you know if Dr. Fauci has spoken up since then to say, wow, it turns out Lancet was wrong? Have you heard him retract that?
I have not heard that. I've not heard that. And that's the thing that happens oftentimes is you never get a retraction. The first story comes out and it's ballyhooed because it fits the political narrative. Now, I don't know Dr. Fauci at all. But it seems to me like certainly if he's going to be consistent, if he's going to have the trust of the American people, then he probably needs to stand up and say, we were wrong about this, and this study does not prove that hydroxychloroquine is not safe. Which is it's laughable to me. And I'm certain that Dr. Fauci probably hasn't taken care of patients in probably 2 decades, I suspect. And so he's certainly not caring for patients. He's a very intelligent guy, very smart guy. But, hydroxychloroquine has not ever been an unsafe drug. I've taken it myself. I took it for 6 weeks every day when I was in Africa. The treatment protocol for COVID-19 is only for 5 days. And so it's been a safe drug. The Z-Pak is a safe drug. We found that there are no cardiac side effects. There were no prolonged QTC intervals, which everyone is expecting. And so we found that the drugs were safe together. And so it is amazing to me that yes, they certainly come out and talk about how dangerous it may be, even though we all know it's not dangerous. But they never retracted. They never come back and talk about the study. And the only place I've seen that those headlines of how the authors retracted the study were on Fox News and on conservative outlets, which is shameful. I had a friend, I was talking with a physician the other day, and he said that he could determine a person's political stance and political allegiance and party that they're in based on the hydroxychloroquine debate. Now that's shameful. It shouldn't be that way. He literally could bring up hydroxychloroquine and a physician would get absolutely angry and say it doesn't work if they're Democrats. And we would say that it works fine, it works great if we were Republicans. I'm simply looking at the evidence. I've used it personally. We certainly beat the odds that most nursing homes are meeting today. Certainly, you would expect to see more elderly folks die in a nursing facility. We did not see that because of the treatment, and so I think that it's had a benefit. It's had a beneficial effect. Thousands and thousands of physicians all over the country are seeing that same effect. Physicians all over the world are using hydroxychloroquine, and it does have a benefit when used early enough. And so I think that we just need to be open to the truth. I was certainly a skeptic of hydroxychloroquine initially, until my back was against the wall and we were faced with an emergency situation. I decided that we would use it. Because I was concerned about it, we monitored them very, very closely, not concerned about the safety, but just concerned about all the reports that I was hearing. And so we monitored them very closely, saw that it was very safe, and we saw that it was effective in this case.
Dr. Armstrong, there's a term, I can't remember the precise what it is, but there is a term about when you, as a doctor, prescribe medication, and the reason you're prescribing it is it's like an off-use label. Is that the right? Okay, so
it's an off-label usage.
Off-label use, yeah.
So medications are used off-label all the time. We have medications that the FDA actually approves for the specific use for a certain cause. For instance, hydroxychloroquine is not approved for the use of coronavirus, but it has been given FDA emergency authorization for use, and it's called an off-label usage. We use medications off-label all the time. This is extremely routine. It's done with a lot of the seizure medications we use off-label. We use seizure medicines for some antidepressants. We use some of them for neuropathy. And so there's lots of off-label use. This is a very common occurrence. Physicians do it all the time. There's actually it's protected in statute where physicians are certainly allowed to, because if you're not allowed to, you just can't do studies on everything. If a medication has been shown that it's safe and the precedent has been shown that it can work in certain situations, then we tend to use it that way. And certainly I think there's a precedent being established now that early on, if we use hydroxychloroquine, it is effective in mitigating symptoms of COVID-19.
So on this off-label use question, when you do that, if you have, let's leave coronavirus out of it, some other issue where you like to prescribe something and to a patient, and the FDA has not specifically said this medication is for this issue, this disease, do you need someone's permission ahead of time, or do you need to do anything as a doctor to prescribe something that is an off-label use, or are you just, because you're a physician, you can make the prescription?
Correct. Yeah, because you're a physician, you can order the medication. You can order the medications because the key is that the medication is safe, and so it's been shown to be safe. And so yes, you can use it off-label for many different reasons. Now, I will tell you that generally the uses of using medicines in an off-label sense is done literally. It's just done all the time. That it's such a common occurrence now that we don't even think about it when it's done. But no, you don't need anybody's permission to do it. It's just such a common practice now. And the key is not hindering the physician. The key is not hamstringing the physician and keeping him from using medications that could have a potential benefit in the patient population. And so the FDA just cannot keep up with every use of every medication. And so there's thousands of medications out there. And so you just can't do a study for every use of every medication. Yeah. It just would be impossible to do that. And so what you'd have folks, we're certainly, people are not robots and physicians are not robots. And some people respond to certain medications in different ways. And so we prescribe them oftentimes off-label.
Is there a process that you or other physicians or some other entity can do to prod the FDA to agree about hydroxychloroquine? Like you talked about France, France pulled it. Is the FDA, can you prod FDA to acknowledge hydroxychloroquine has been effective in coronavirus, or is that not really something that's a process that you can engage in?
Well, yeah, it certainly is. I think, I think that they're very prone to media scrutiny, and I think that's what's happened here. Is they have really, I mentioned this when I was on the Laura Ingraham program, that they have really not served us well in being so sensitive to the media scrutiny that's taken place. And I think that certainly these clinical trials that are coming out are going to show efficacy. Certainly doctors are using it. What I would do as well is I would encourage every physician who's using it to keep accurate records, very detailed records of the responses that he's gotten from his or her patients. And I think that's the best way. We certainly we are preparing a paper with our observations in it, where we checked oxygen saturations, respiratory rates, temperatures. We monitor their mental status as well. And so we're actually looking back at all that data that we have recorded, kind of retrospectively looking at that. And then we're going to place those observations in the paper and try to get that published as well. And so it's just important for physicians to present their findings so that we can prod the FDA towards saying, look, like this is something that has been beneficial in mitigating some of the coronavirus symptoms.
Okay, one last thing. First of all, this is so informative. I really appreciate it. I'm so glad you were available today. When you first said that you had heard some doctor mention that you could tell someone's political persuasion by their reaction to the idea of using hydroxychloroquine in a coronavirus case or COVID-19 case, I thought you meant people generally, patients or friends. You're talking about the actual medical community, the doctors. I mean, it's like facts are different medical facts are different if you're a Democrat versus Republican. It's obviously not true. I mean, that just shows the pervasive impact of the political mission, in my view, the pervasive impact of the political mission to undermine President Trump to the point a doctor who must know some about the studies that you're talking about and the studies that have been published will still hang in there and say, no, it's a bad thing. I think that's troubling and kind of astonishing. Absolutely it is. But you know what? What we'll find is when their backs are against the wall, when they have a loved one that's ill, then they certainly would prescribe it. And that's something I've seen as well, is that a lot of physicians who are very skeptical of hydroxychloroquine certainly have a script at home in case they get ill or in case one of their loved ones get ill. And I think that's one of the that says it all. That folks who are most skeptical of it, they still keep a stash of it at their house in case they get sick. And so it's unfortunate that politics has been injected in this. The headlines of the stories, when it came out what we had done at the nursing facility, many of the headlines said, Trump ally uses unproven drug. It was all about President Trump. It was all about, it was almost presented in a sense that I used the medication because President Trump had mentioned it. And it's amazing to me, because one thing that liberals and leftists don't realize, Trump is certainly the center of their world. Their world is all about defeating Donald Trump. They live that and breathe that every day. Well, the President of the United States is not the center of my world. Every decision that I make is not based on defeating or electing a President of the United States. There are decisions that are made certainly completely separate from that, but I think that differentiates much of the left from the right, much of Democrats from Republicans, is that Democrats, they have this reaction to this president that they just absolutely hate him, and they think about him in extraordinary terms. We never
talked about Barack Obama this way. You know, I wasn't so infatuated with President Obama that I felt like he had influence in everything that happened in the United States. You know, certainly I disagree with all of his policies just about, but I certainly didn't ascribe any kind of evil intentions to him. And so I think it's shameful what the left has done, and I think we need to call them out on it. I think that there's a lot of independents out there. There are a lot of folks out there who are saying, you know, this has gone way too far. Folks who don't necessarily support the president understand that what the left is doing now in medicine, what they're doing with police departments, talking about defunding the police, they believe that the left has just gone way, way radical and just beyond any kind of reason. And so I think that they're going to punish them for it in the fall. I think we're going to see great victories all up and down the ballot. The president will be reelected, and we'll see many, many Republicans. I believe there's a good chance we could take over the House, because I believe that the left is really just they've just gone way past what is reasonable, and I think the American people see that.
Dr. Armstrong, you got to know I agree with that. Absolutely. I do want to add one more question. I know I said that. This is really one last question. I read somewhere one of the arguments against hydroxychloroquine, which was if doctors prescribe it for people with COVID-19, we may encounter a shortage for people who need it for malaria. I think lupus was listed, other reasons that people take the medication. So my two questions, is it really expensive to produce? Is it an expensive medication? And second, are we actually in some phase where there could be a shortage?
Well, no, that's not going to be an issue at all. It's exceedingly cheap. Actually, it's a very inexpensive medication. The patents run out on it a long, long time ago, and so medication is produced very cheaply. So no one's making money off of hydroxychloroquine. I'll guarantee you that. And so it's a very inexpensive medication, and so that's you know, that's one of the beauties of it, is that it's so inexpensive. And no, we're not going to have any shortages. Certainly not in the state of Texas. You know, we received a state senator, Brian Hughes, was instrumental. He has a relationship with Amneal Pharmaceuticals, who makes hydroxychloroquine, and he was able to get a shipment of 1 million doses of hydroxychloroquine to the state of Texas.
Wow.
And so Texas has plenty of hydroxychloroquine. It's under lock and key at the State Board of Pharmacy right now. I suspect we haven't been using as much of it as we should have, because for a while the state board was limiting its usage, and one of our state senators, Bob Hall, called and actually got them to rescind that order. And so they were requiring physicians to write a diagnosis on the script before they would prescribe it, and so before the pharmacies would give the medications. And so he was able to get that reversed. But we have plenty of hydroxychloroquine, and there's not going to be a shortage, certainly anytime soon.
Dr. Armstrong, first of all, thank you for your advocacy and for being available today for your advocacy. Look forward to reading the piece you said you're writing about your own study, your own experience, as well as your piece relating to the issue of whether the danger when politics get in the middle of medical policy and just care for patients. So thank you for all you do. Thank you so much for being available today.
Well, thank you very much.
Thank you, sir. Okay, Dr. Robin Armstrong, and we're going to watch for his article. I know it'll be a great one. He's a smart guy. One last quick story. I went out of order to say that Matt the Wonderful has quick hit this story about the University of Pennsylvania. Great medical COVID news out of University of Pennsylvania. Yeah, we're not out of order because we had a little, anyway, we're a different story we're on, Matt. It's UPenn, great COVID news from UPenn. But here's a quick thing on it. So, University of Pennsylvania, Ivy League school. So, you know, very, very hoity-toity school. They had a doctor there who was recently giving interviews and basically saying, his name is Dr. Donald Yeley, Y-E-A or Yealy, Y-E-A-L-Y, who's basically, he's the chair of the emergency medicine department at the University of Pennsylvania Medical College. So he's a serious guy, a substantive guy, who's basically saying good news is breaking out all over the place with respect to COVID-19. He's talking about the fact that as they continue to test, there are fewer and fewer people who have a problem, fewer test positive. He's saying the total amount of the virus even the patient does have it, the total amount of the virus the patient has is much less than earlier stages of the pandemic. The proportion of people who need to be hospitalized and even potentially put on a ventilator is reducing. He's basically saying the virus is dissipating around the world. Italy has been reporting the same thing. The virus is dissipating in Italy too. In fact, it's practically down to the numbers before it started. Very, very low spread rate. So Italy numbers looking great. And this guy at UPenn was very positive in giving an interview, because if you think about the headlines you do see, what you see over and over and over is always new cases, 75 new cases, and never any context, never any, but, X number, most, whether they're referring to people who actually tested positive but have no symptoms, or people who had very mild case and didn't even have to go to the doctor, didn't get medication, like you often do with the flu, you just kind of write it out and you're done with it. You only see scary headlines. This is a good headline from University of Pennsylvania saying that all the numbers are heading in the right direction. Fewer cases, fewer people needing hospitalization, fewer people needing ventilators. He actually said in this interview, your risk of getting into a car accident if you go back and forth across the turnpike in Pennsylvania is greater than your risk of being positive for asymptomatic COVID-19 infection. He also said the number of the whole myth that the asymptomatic people who come into contact with the virus but are not ill, so they're asymptomatic, that there was still a fear those people could be spreading it. Almost nil chance they're spreading it. So lots of great news in the world about COVID-19, and I'm so glad we had a chance to talk to Dr. Robin Armstrong, who is one of the leaders in speaking out about the idea that doctors need to be the ones in charge of what they prescribe. He had tremendous success using hydroxychloroquine in his practice in Houston. You have Lancet magazine. We didn't even get to dive into it. Maybe I will another day. But the published study at Lancet magazine, then published by New England Journal of Medicine, then quoted by WHO, World Health Organization, when they dropped their study, quoted by Fauci. Around the world, organizations dropped hydroxychloroquine because of this study. The Lancet has now totally walked back. And the entity that was the source of the data, one reason they had to walk the study back was because the doctor, a tiny little company here, shady, as Dr. Armstrong called him, small company, very shady, did not ever produce the data even to the other 3 doctors who were the author of this big study at Lancet. So the other 3 doctors said, hey, wait a minute, something's wrong here. They first put a little, asterisk, unsure about this, and then finally still got to walk the whole thing back. So lots of great news that we're really doing very well in our country with coronavirus. With COVID-19, the world is pulling out of it. We have in America a fabulous experience. Dr. Armstrong, you just heard from, Dr. Yvette Lozano here in Texas. Doctors around the country finding hydroxychloroquine being successful in treating COVID-19. We have great news, and all we need to do is have to get the FDA and Dr. Fauci to fess up and tell America where we really are. My friends, I'm out of time for this show today. I'm going to quickly do, as I love to at the end of every show, tell you why the stories we talked about today matter to you. So today we talked about Trump-Deranged GOP'ers, why it matters. Mitt Romney, he's another one. Mitt Romney, Colin Powell, George Will support Biden. By the way, George W. Bush was quoted in several stories saying that he was not going to vote for Biden, and he denies that he said that. W's at least denying he said that. Living inside the Beltway media bubble does this. Russia collusion hoax description of DOJ and FBI, impeachment scam, phony pandemic lockdowns, and the Black Lives Matter Antifa anarchy and the destruction are from the party of Joe Biden, but are not problems to them. Electing as a commander-in-chief, patently senile man, Biden, suffering from dementia is not a problem to them. But re-electing Donald Trump is a problem to them. Some medical evidence, Trump derangement syndrome, may cause brain malfunctioning. You're not kidding. The stakes for the future of freedom under the Constitution could not possibly be higher. Only President Trump gives America a fighting chance. And on great COVID news out of UPenn, coronavirus is dissipating. Fewer people testing positive, cases less severe, infection from asymptomatic carriers highly unlikely, importance of vaccine therefore in question, consistent with what happens to most viruses as warmer temperatures arrive. This is all good news for America and the world. And finally, Lancet's Hydroxy walkback and Fauci's silence. Extraordinary tell in the past 2 weeks. Fauci, World Health Organization, and Lancet coordinated timing of public denouncement of the efficacy of hydroxychloroquine. I didn't make that clear. It was a timed, orchestrated, everybody stand up and talk about how bad hydroxychloroquine was because, as Dr. Armstrong pointed out, because Trump said it was good. This is why they did this. No empirical evidence of efficacy was flat out false. Listen to what Dr. Armstrong is saying. The Lancet study touted for disproving hydroxychloroquine efficacy suddenly retracted by Lancet as fraudulent. Fauci silent on the retraction of the Lancet study, and that is not okay. Fauci is not acting like a doctor, honestly happy for sick patients getting well via hydroxychloroquine. He is not acting like a doctor embarrassed by reliance on a fraudulent study. He's exposing himself as a tool of big pharma and mandatory vaccines and the anti-Trump mission. Americans ask, how much of Fauci's pandemic advice has been about science versus a worldview supportive of globalism and mandatory vaccines and above all getting rid of Donald Trump? And this, my very fine friends, is America Can We Talk for today. Thank you so much for tuning in every Monday through Thursday, 3 p.m. Central Time, to America Can We Talk, where I always talk truth about America because America matters. And I'll talk to you next time.
America Can We Talk? Truth about America.
Can you hear?